So hemorrhoids or piles are a condition that affects your bum or your anus. See, if you separate your bum cheeks, you'll see, the old anal hole there, or your date hole, and this here is a cross section. And if you have a look at it, you'll see that the actual anus is a tight ring of muscles, and it stays tight until you have a crap, and then it'll loosen up, and then your bowel motion goes out. So hemorrhoids are a normal thing that occur in the anal canal here. And what they are is just areas of blood vessels that are collected together in cushions. Everyone's got them. And so they're almost a normal part of your anatomy. But they can swell up and become troublesome, and that's when they become what we call hemorrhoids or piles. The way they present is people can get a bit of bleeding from their bum if they rupture, or they can get discomfort down there, or the piles can form a lump that can even pop out of your date hole. So who gets hemorrhoids? Well, unfortunately some people can get them for no reason at all, and it just very unfortunate. It's almost genetic. But there are things that put you more at risk of getting these, like, for example, if you strain on the toilet a lot, it puts a lot of pressure on your bum or your anus, and that can dilate up blood vessels and cause hemorrhoids to form. So if you get constipated a lot, then you can get hemorrhoids. Equally so, if you're overweight, there's more pressure on the blood vessels in your anus to form these hemorrhoids. Or if you cough a lot, say if you're a smoker, when you cough really hard, you'll feel a bit of pressure in your bum. Also, unfortunately, some women tend to get them in pregnancy because the blood vessels tend to dilate up. So pregnancy is a risk factor as well. Now the key issue is if you think you've got hemorrhoids with either bleeding from your bum or swellings down there, or quite bad irritation, the important thing is to get your GP to check it out, because hemorrhoids are easily fixed or dealt to. But unfortunately, there are some serious diseases that can present like hemorrhoids, like for example bowel cancer or inflamed bowels, and you might think you got hemorrhoids, but you've actually got those nasty illnesses. But you can also have both hemorrhoids and those nasty illnesses. So whatever I'm saying is that if you get those symptoms, you need to get your doctor to have a check. It's not a big deal, and they can sort out and say, no, it's just hemorrhoids, this is what you do, either creams or a bit of surgery, no big deal. But they can reassure you that there's nothing nasty as well. So that's hemorrhoids, folks. It's not a cell phone, and piles are not referring to the foundation of a house. It's something to do with your bum, and it's very important you know all about your body, and that's what I'm trying to do.